We really want systems, and we're really willing to help build those systems that make it easy, again, for the clinician to do the right thing at the right time and to really help transform care. So we're volunteering, and the only real reason to include a nurse is because if you want to be successful. So thank you for this opportunity to give my comments.
Dr. Bradley, thank you so much. Our next speaker is Curtis Dikes, who is the National Director for Clinical Informatics Technology Integration at Kaiser Permanente. He interacts with business and clinician partners to identify and deploy clinical care technologies that foster clinician efficiency, promote quality of care, and patient safety, and otherwise supports clinical improvement goals. He is an innovator in technology design and integration, engendering optimal healthcare design and delivery, using his background as a clinician with expertise in nursing informatics, advanced practice nursing, and biomedical ethics. An active member of advisory boards, including the American Hospital Association Solutions and Vocera. Curtis is also a board member, including past president of the American Nursing Informatics Association, a steering committee member of the Alliance for Nursing Informatics, and an active member of the HIMSS and American College of Clinical Engineering Communities. Thank you.
Thank you, Linda. And also thank you to the Board of Directors for inviting us here today to share with you about nursing and its usefulness in HIT implementation, and thank you to the staff also. So I'm a board-certified nurse and also formally trained in nursing informatics and have this national role at Kaiser Permanente. What I do daily is identify, review, and implement new technologies that complement either our existing or planned national systems architecture and ensure that there's value-added clinical technologies, that they're married successfully with operational workflows and desired business outcomes. And I'm one of those nurses that have actually gotten my hands dirty in a build. I've been involved from the system selection process on through implementation training and living with the system over time. And people often think once the system's installed, that's it, but that's really when the next part of the journey starts, and that is tweaking it and making it work better and better over time. To share a little bit with you quickly about Kaiser Permanente. Kaiser was actually created, the creation resulted from the challenge of providing Americans medical coverage during the Great Depression and World War II, when most people could not afford to go to a doctor. That's an interesting fact given today what we're facing here in 2009. We were founded in 1945, and we're the nation's largest not-for-profit health plan, serving more than 8.6 million members in 10 states, including the District of Columbia. We have 36 medical centers and over 430 medical offices, employ 180,000 employees, and have revenues of greater than $40 billion annually. In comparison, Kaiser Permanente is larger than 40 states and over 140 countries. Kaiser Permanente is spending upwards of $3 billion on our electronic health record product, which we've branded KP Health Connect. We also have the largest civilian installation of an EHR in the world. Now I'd like to share a little bit with you at Kaiser about the connected patient.
We know technology can make you more connected, but now it can make you more connected to your doctor through email. Test results from home. Check records. Change appointments. Now, doctors, nurses, techs, pharmacists are all digitally connected to each other and ultimately connected to you. At Kaiser Permanente, we believe that if knowledge is power, shared knowledge is even more powerful. Kaiser Permanente, thrive.
So what'd you think? Do you think nurses are involved in the care of the patient in this video? Do you think that nurses were involved in creating the workflows and designing the content which this patient interacts with and exchanges information with? The answer is yes. At Kaiser Permanente, nursing is very much involved with HIT. Talking about nursing's involvement in HIT and at Kaiser, as I'm presenting a provider's perspective here to the panel. There are implications for different types of interactions with patients. Nurses are key to defining and developing this. You see from the slide here that in last year, 2008, Kaiser Permanente had more than 6 million e-visits. with those visits, we know that over 16 million lab results were reviewed. So our patients that have the ability to get onto the portal that you see there on the screen can communicate with doctors, nurses, pharmacists, and review lab results. Nursing needs to be more proactive in envisioning how clinical practice will and can evolve with telehealth, different devices, as well as decision support, to name but a few. New practice models will evolve, and we need to recognize and be ahead of this. At Kaiser, we have 45,000 nurses, which make up about approximately 28% of our workforce. There is appreciation and recognition made early in the planning stages for EHR that nurses are important and they must be included. An example of nursing integration and system selection was when several years ago when we were doing vendor selection processes. I was involved as one of a few key nurses that toured the country looking at the different vendors and what they had to offer, as well as doing site visits to see did what they have really work. And a key piece in the ultimate system selection of the product that we chose to use was getting the buy-off of key players. And at Kaiser Permanente, that was not only physicians, but also nursing, pharmacy, and some other disciplines. It had to work for all of us for it to be a good product. Speaking from a governance perspective, KP is a unified nursing build in our EHR, including a robust decision-making body and processes, and a solid network to ensure frontline staff's voices and experiences are continuously heard and incorporated into solutions. An example for you of nursing's involvement in standardization and workflow redesign is Kaiser's process to move paper documentation forms into an electronic format. Now, there's often a misnomer that we just take everything we have in paper and we dump it into the electronic databases and go. One can do that, but they're going to face, as my colleagues know well, some workaround issues. What works one way does not necessarily work the same or can be carried out the same in a different format. In one of our regions, 13 hospitals we had, they had gone through an onerous process 2 years prior to us working on this for electronic health record of making the various forms that nursing used in the inpatient and interdisciplinary areas consistent. So we took 13 hospitals and we were able to standardize on 130 different documentation forms. Still seems like a lot, but we came down from hundreds others. A different region, approximately 17 hospitals, they acted and operated independently in that they had their own sets of forms and data collection, and it was what it was. So there was a lot to be done. Recognizing, as the slide says, one is essential. We wanted one nursing build. We wanted one decision-making body, and we wanted to have a unified voice for frontline staff. So we took those pains, but made strides to boil this down to have one set of electronic forms in which we could document consistently on our patients regardless of where they are. And by nursing doing this, it was able to help us enable that connectivity of our charts and for them to be able to be passed throughout the system within the medical center, across medical centers, across our enterprise, and that information is accessed and viewed the same. And also that contributed heavily to dollar savings with the build of the system as well as the ongoing maintenance. Nursing leadership must continue to speak up for nursing's needs across the care continuum. For example, nursing involvement is instrumental to help solve for transitions in care, be that outpatient to inpatient, inpatient to inpatient with various levels of care that change during a patient's stay, as well as inpatient to outpatient in those various venues, not only to home, but it could be to a different community setting, hospice, looking at telehealth and what that will mean to us. Speaking to the future, there's an increasing ability to leverage the power of our EHR. Nursing has the key opportunity to understand data and trends and incorporate this into quality outcomes, service improvement, and overall improved care delivery. So healthcare delivery is changing. More care is being delivered in unconventional methods. Remember that slide about the 6 million e-visits in 2008? That's only going to increase. George Halverson, Kaiser Permanente CEO, says it's the engagement with the nurse that people remember at their encounter. It only makes sense that to maximize this opportunity, nursing must be involved in the design and thus the outcome of our HIT projects. Another important point on this slide, we can't afford for nurses not to be involved. It's estimated at an annual cost of $50 billion for nursing documentation. This is based on time and motion study findings, and David Cutler, well-known economist, looking at this in a recent publication in the New England Journal of Medicine. He referenced that work in terms of documentation, and note this is only for medical surgical units. Kaiser Permanente seeks to be the best national and health plan in the country. Nursing is key to this. For nursing to be its best, nurses must be involved from the get-go, including HIT. That's what the leverage of nursing is all about. So, a few parting thoughts for you. Include nursing in the HIT agenda. Nurses can do a lot as both a thought and working partner. Include nursing in technology design and evaluation at the beginning. Nurses can help with adoption and recognize and reduce technology misuse. You've heard from a prior speaker, and you'll hear it from our other speakers this morning, about meaningful use in HIT. Current meaningful use working definitions on the surface looks a lot to be very physician-oriented, but when you look more closely, the data that is required to drive the decision-making, quality improvements, and reporting is largely going to be gathered from nursing documentation. There's also a component related to coordination of care, which has nursing written all over it. This is going to take a clinician team effort. Ensure nurses are named as meaningful users of technology. So, if you remember nothing else, nurses have a critical role in HIT implementation. Include them from the onset. Thank you.
Thank you so much, Curtis.